I'm Dr. Dewald Bester. I'm the Interventional Radiologist at M&D Radiology at the new Johannesburg Surgical Hospital in Northcliffe. We are happy to share with you a very interesting case that we did recently of a angiomyolipoma embolization. So let me tell you a little bit about an angiomyolipoma. It is the most common benign solid tumor within the kidney. It consists of fatty tissue, also consists of smooth muscles and abnormal blood vessels. And what makes it a problem is it is prone to rupture when it reaches a certain size, usually more than about 4 centimeters. And this can cause a catastrophic retroperitoneal hemorrhage, which will then need an emergency procedure. So the treatment for that is to do either surgical resection, or you can do a minimally invasive procedure with endovascular coil embolization. So our patient is a female patient. She is 75 years old. She presented with a sporadic angiomyolipoma, and we decided that it's the correct size and that we need to embolize it to prevent any complications further down the line. Just an interesting fact, it's usually female patients that get angiomyolipomas. It's usually sporadic in about 80% of cases. In about 20% of cases, it could be associated with conditions like tuberous sclerosis or von Hippel-Lindau syndrome. So in this patient, it was just found incidentally on an abdominal CT scan. So what we did for the patient is we punctured and we accessed the right common femoral artery. We went into the aorta with a catheter and also to the renal artery on the right-hand side. We did a digital subtraction angiogram, which demonstrated all the blood vessels in the kidney and also the angiomyolipoma, which was situated on the upper aspect of the kidney. We then took a small microcatheter and we went into the supplying artery, gave some contrast and outlined the tumor. Then what we did is we took a small endovascular embolization coil and we advanced it and we blocked the blood vessels supplying the tumor, thus denervating and taking the blood supply to the lesion. On the post-embolization DSA of the kidney, no blood flow was demonstrated in the tumor lesion, but normal blood flow was demonstrated to the remainder of the kidney. So this minimally invasive procedure is just another good example where endovascular embolization is a good alternative to conventional surgery with good clinical outcomes for the patient. Thank you for listening.